Welcome to the Texas Medical Association's Distance Learning Center. Timely, convenient education from TMA, your trusted source for practice and professional needs. We would like to thank Pfizer for sponsoring this free program for TMA's Leadership College.
Hello, I'm Robert Strauss. I'm an emergency physician. I practice at the Christ Hospital in Cincinnati, Ohio. I'm a senior vice president for Team Health, and I run the American College of Emergency Physicians Directors Academy, a four-phase curriculum to help develop leadership and administrative skills for emergency physician leaders. Today, we're going to talk about running effective meetings. Meetings can be very frustrating for all of us because they don't seem to accomplish what it is that we've come to do. The value of meetings. How much time do you spend in meetings, doing the work for meetings or preparing for them? Administrative physicians, perhaps like you, certainly like me, will tell me that they spend between 10 and 50% of their time actually in meetings, preparing for them, or the most work, which is doing the work that's been assigned at the meetings. Now, that's okay if meetings are valuable. If they're not valuable, then it's a terrible waste of all of our time. I'm going to provide 3 video clips and then discuss them briefly. They are somewhat caricatures of what goes wrong. The first is a terribly disorganized meeting that has been poorly planned. It's called Dealing with Socializers and Eliminating Parallel Play.
The next item we have on our agenda is from the Quality Assurance Committee. Alan, when you're ready, go ahead and tell us how we're doing.
Thank you, Gretchen. JACO, which stands for the Joint Commission on Accreditation of Healthcare Organizations, evaluates and accredits more than 15,000 healthcare organizations. It's an independent, not-for-profit organization. The Joint Commission is the nation's body in healthcare.
How was dinner at the restaurant last night?
Oh, it was great. The ambiance was terrific. We had a private room, and the wine list was just exceptional.
What did you have?
We had the Cabernet Sauvignon, the Stag's Leap. It was really good with the beef entree.
Is it just me, or does the staff on the 4th floor seem pretty flaky? I mean, there's been a lot of turnover lately, and we're constantly having to reorient the new nurses to our group's protocols. If someone's not getting married, there's someone having a baby, there's just always an excuse.
It's frustrating. All the good nurses never seem to stay.
Exactly.
Health organizations and programs in the United States. It's an independent, not-for-profit organization.
So let's discuss what happened. What are the causes of poor attention to a topic? Well, certainly boredom. This was an uninspiring topic. An inappropriate presentation. This was so poorly done. There were way too many words on the screen. And in fact, it was just plain uninterested. Now, certainly there could be some insincere participants, people who are the wrong people to be in the room, but that was not the case this time. What happened with the presentation? Well, everyone seemed bored. This was not an issue that was of interest to the group. There was no engagement, and the lights were turned off. Now, that's okay to turn off the lights, but hopefully what's going to be appearing on the screen is going to be riveting and interesting to the people. So let's assume that you are the chair and directing this meeting. Once the side conversation begins, how can you get people more focused on the topic? Well, you could ask a socializer a simple but not embarrassing question. Never humiliate somebody, such as, well, what do you think the point of this particular topic on the Joint Commission is? Or simply ask the group to please focus on the discussion, or even ask the speaker. In this case, it might have been quite wise to ask the speaker to really refocus and describe the salient points. However, this particular presentation was a problem when it began and should have been addressed prior to beginning. While it's a little bit of work, the chair is absolutely responsible for the content of the meeting. what might have happened in advance was simply to review the presentation in advance, the salient points, the issues that should be discussed, describe specifically its duration, and make it an action-oriented, engaging process. So review with the presenter what will be discussed. So how do we get our training to lead meetings? How did you get yours? Many people will say it was on-the-job training, or I just saw people doing it incorrectly, so I'm going to do it differently. Very few people have actually been to a course and have gotten an ACPE, we've gone through ACPE or gotten an MBA, but most people really haven't learned. And how do we get to be leaders in meetings? Very often it's simply because we raised our hand at the wrong time. And so now we're in charge. So there are meetings that are poor, and when asked, most people will say that they're just terribly organized. Perhaps the members don't participate. They're uninterested. They're unprepared. They don't complete their assignments. They show up late. The meetings themselves are disorganized. They're boring. There's no control of time. They're a waste of time. Nothing got accomplished. They start late. They run over time. Or the chair maybe sets the wrong tone. They're talkative, unprepared, don't communicate well, don't follow the agenda, and they are lackadaisical, perhaps sullen, and ridiculing. So all three of these are the reasons for poor meetings. But meetings can be good. The characteristics of a good meeting are a dynamic, passionate, focused, engaged process that extracts the collective wisdom of a team. The goal is to transform this painful, tedious process into something productive, compelling, and even energizing. To distinguish our meetings, they've got to be well-conducted, time-efficient, meaningful, and focused. So in this brief discussion, we're going to talk about whether to have or not to have a meeting. Rarely considered. How to prepare in advance. Often considered, but not commonly done. How to conduct the meeting. Always done, but often poorly. And then what to do after the meeting ends, other than to have a good cry. So let's talk about whether or not to have a meeting. There are many meetings that we have that are monthly meetings. It's always surprising to me that we can always, every month, have a meeting that lasts exactly 2 hours and covers all of the important information. Oh, that is, every month except August, when we all take a month off. Unfortunately, again, most meetings become rituals rather than meetings to accomplish very specific and focused goals. So whether or not to have it, there are times not to have a meeting. When would you not want to have it? When you already know the answer. There's no buy-in necessary, no information to transmit, and there's nothing important that the participants need to know. But there are two reasons to have a meeting. Reason number one, of course, is a problem-solving meeting. This tends to be a smaller group of people. This is a meeting where we need input and, importantly, buy-in. These are more nuanced meetings, and they accomplish very specific goals. People leave with specific action items, and problems are solved. The other type of meeting is an information exchange, more like the type of meeting we're having right now. It's built for the simultaneous dissemination of information that is apparently important to the participants. You've actually volunteered to attend. Advanced planning leads to success. What does that entail? Well, it entails the person leading the meeting to, in advance, determine what he or she would like to accomplish. And then I say this somewhat figuratively, write the minutes before the meeting. Not literally, but the person leading the meeting should absolutely know what it is that they are attempting to accomplish and the way that they intend to get there. Component is creating an essential agenda. I believe that we should be using action verbs. What is an agenda? It's a roadmap, it's a timetable, it's an overview, it's a goal setter. It cues the person leading the meeting, it enlists the attention of the members, and keeps people all moving in the same direction. So I'm going to show you another video, and this one is called Poor Preparation. This is what happens when preparation by the leader of the meeting does not occur.
Well, sorry I didn't have time to prepare an agenda today. What would you like to talk about?
We could continue our discussion on the new safety standards.
Good idea. We were going to revise our Sentinel event procedure. Drina, you were going to look into how others are identifying and reporting these.
Yeah, but I didn't think that was due today.
Well, why don't we start by reviewing our current event report process? Does anybody have a copy of their protocol with them? Well, we got to get this done. I don't want to waste any of your time. Give me a couple of minutes and I'll go grab it. Be right back.
So what happened? There was no agenda, no plan, no preparation, and the meeting continued. This seems incredibly rude to me. It's the chair's responsibility to value the people and their time. To be unprepared delivers the message that as the chair, my time, not preparing but doing something else is more important than your time. An agenda should always begin with orientation, creating vision, setting tone, describing the importance. We must share with the people with whom we're meeting what we want them, where we want them to go in order to get them there. Without this process of orientation, members have the potential to be moving in different directions. Now is the time to set the tone that this is important and describe what will be accomplished during the meeting so that people have the map. Next, after discussing the goals, there again, if you notice, there are action items. Describe existing programs, list equipment, define the IT support, describe the rollout in education, and note particularly that we start with simple, easier processes rather than the more complex and difficult issues. It's similar to warming up for an athletic event. You start by stretching and loosening up. In this case, early, simple discussions and agreement will set the tone for collaboration later on. Now, there will always be naysayers in meetings that are important and review critical and important issues. We want different opinions. That, again, creates nuanced and valuable solutions. But why put it to the end? Well, the advantage of putting the roadblocks to success, which are necessary at the end, is it allows people to suspend disbelief early on. So one can simply say, if you let naysayers interrupt early, you may get way off track and lose the ability to move forward. So roadblocks again are necessary. What one can say is yes, if somebody interrupts with some roadblock, we absolutely will discuss these problems. You're right; these are important. For now, let's discuss what it would be like if we were able to overcome the problems and if we accomplish the best outcome. Naysayers are important, and they must have their opportunity. It just organizes the time that they will speak if you allow it to occur at the end. Effective agendas avoid pandemonium. As I showed you, take easier items early. Make sure that our meetings are accomplishable. Sometimes we try to squeeze too much into a much too small space, creating some degree of pandemonium and great frustration. It's awkward, it's uncomfortable. Ideally, we will end our meetings on time or even a little bit early. But let's lead the meeting. Unfortunately, many of our meetings are poorly run. A poorly run meeting is very much like a poorly run resuscitation. No matter what the outcome, no matter how successful the outcome, if there are many voices speaking simultaneously, people will all feel like things should have and could have gone better. Most of us have very little formal training in meetings, and it's not surprising that meetings are not run particularly well. So what should one do as the director of a meeting? Create a positive first impression. We must set the tone. What you project will significantly influence the members. If sarcastic, late, slumped, lackadaisical, disinterested, and unfocused, so will other people be. If we arrive on time or early, we're sincere, even enthusiastic. Sit forward, not slouch. Demonstrate interest and vision. Hook them early. Understand and make it important to those who are there. Now, perhaps not Hamlet, but it must be about what's important to them, their future, their families, their practice, things that are important to those that are present. Now, on this next slide, we're going to talk, I'm going to show you a video about getting the derailed train back on track. How can we deal with these digressions that so frequently occur?
Now we're going to discuss the changes in the formulary. First on the list is the removal of Lovenox and replacement with Fragmin.
Oh, that's too bad. I'm so used to using Lovenox and it works so well with my patients. Any idea why the pharmacy wants to make that change?
Well, the last time they made a change like that, it was to save money for the hospitals. You know, it's frustrating to me that we can't use the medications that work.
That's so typical here. Save money but making it increasingly difficult to practice. I'm getting so fed up.
I know what you mean. Just last week, I was getting pressured from the case manager to release a patient before they were ready to go home. That's my license on the line, my malpractice.
Exactly. I mean, have you seen what's been going on with malpractice rates lately? It's nuts. It's all these damn malpractice attorneys. And I just got sued. I'm telling you, it's just not fair.
Really? What happened?
Well, there's some deadbeat patient doesn't want to pay me, so now he's suing me.
So what is the cause of digressions? Well, there are lots of causes. Very often we all have hot button issues, and our button gets pushed because we're preoccupied with something that's part of our personal agenda. We often have a desire to tell personal stories and discuss personal anecdotes, or perhaps we're bored and don't have a clear understanding of the current topic. So what's necessary for digressions to continue unabated? Essentially, nothing. If we do nothing, they will continue. We do have a responsibility. What is necessary to get the discussion back on track? Well, I first believe that we should always use the theory of yes. It is always possible to affirm a person's point of view, to appreciate their input, even validate their input. It's important. So in this case, when the person began speaking about the case manager controlling the care, one could simply say, yes, this is important. We've all felt some discomfort about that. Let's discuss how to address that after this meeting and make sure it gets to the right committee for discussion. Or for the person who starts talking about the malpractice situation and how terrible it is, again, validate and then get back to the primary issue. You bet, malpractice is a real problem. Unfortunately, we won't be able to solve it here. Let's focus on the issue over which we do have some control. Again, methods include the parking lot and taking it offline and then refocusing on the original agenda. I believe our mantra should continue to be we massaging this discussion forward? Ask yourself, are we moving forward? Is this pertinent? Is it redundant? Have we heard this? Is it a repetition of what was just said? So there are methods of shaping. Recount the different opinions. Let them know that you heard, and it makes it unnecessary for them to state it again. Yes, Janet, you said that you've had great experience with care maps and you believe they should occur. Robert, I understand that you've had some bad experiences, and in particular because one size doesn't fit all. Are those the two opinions? Is there anything more anybody would like to say? Okay, let's move the discussion forward. At a certain point, we have to conclude the meeting. I believe that it is valuable to end a meeting a few minutes in advance, to be careful to allow a few extra minutes. Even in large meetings with 20, 25 people, I will then, at the end of the meeting, say we've come to the conclusion of our agenda. Is there anybody who has some burning critical issue that if they don't say it, they will feel that they lost an important opportunity? I want you each to nod if you don't nod no if you don't have any, and then I visually walk around the room. Invariably, one or two people will have some hot-button issue that they want to put on the table. Occasionally, that's an issue that requires more discussion, at which point one can simply say, yes, this is important. Why don't you and I, after the meeting, figure out how we can ensure that it gets discussed and gets the right amount of attention. This way, people don't leave the meeting frustrated that what they thought should occur did not. Schedule the next meeting, and then I believe it is important to intermittently assess the effectiveness of a meeting. And the way to do that is simply survey the participants. Here's an example of a survey. Of course, it's been reformatted so you can see it, but was the meeting effective and efficient, productive? Did people live up to their responsibilities? Do we maintain a focus on improvement, whatever it is that you think, but that way you, as the leader, can get feedback on whether it worked or not. With that, I will conclude. I appreciate the time that you've spent with me. I hope this has been of some value to you. Thank you very much.
This concludes our program. Questions? Contact the TMA Knowledge Center at 1-800-880-7955. Thank you for using the TMA Distance Learning Center.